Addiction is the psychological and physical inability to stop consuming a drug, chemical, or substance. But it can also be an activity, such as gambling. The person knows they're causing themselves psychological and physical harm, but they're unable to stop. Addiction results in intensive cravings for the substance or activity. Addiction also changes the brain by changing the way it registers pleasure, and also changing our other drives, such as motivation and learning. No one wants to be addicted. There are two types of addiction: substance addiction and behavioural addiction. People who have substance addiction become addicted to substances such as drugs, alcohol, tobacco, solvents, and so on. People can also become addicted to certain behaviours such as gambling, shopping, sex, or risky sports. So what causes addiction? Addiction has a powerful influence on our brain in three main ways. It causes us to crave the object of our addiction. It causes us to lose control over its use. And we continue to use it despite the fact we know it has negative consequences. Addiction is a chronic disease that changes the structure of the brain and the way it functions. How then does addiction start? The first step is the recognition of pleasure. Our brains register all sorts of pleasures in the same way, whether from drugs, sex, or a good meal. In our brain, pleasures register in the release of a neurotransmitter called dopamine. Dopamine is released into an area of the brain called the nucleus accumbens. Neuroscientists refer to this as the brain's pleasure centre. Drugs such as nicotine and heroin can cause a surge in dopamine in the nucleus accumbens. This makes the drug a rewarding activity and leads to addiction developing. Scientists used to think that this experience of pleasure was enough to lead to addiction. However, it's more complicated than that. Dopamine has a role in our experience of pleasure, but it's also linked to memory and learning. This is important when we move from liking something to being addicted. The reward circuit of the brain is linked to pleasure, but also to motivation and memory. So addictive substances and behaviours can overload that reward circuit. Theories suggest that dopamine interacts with another neurotransmitter called glutamate and takes over the brain's reward-related learning system. This is an important system as it's needed for survival, linking eating and sex with pleasure and reward. By repeatedly exposing our brain to addictive substances or behaviour, our brain is affected, going from liking something and wanting it to an intense drive to seek it out. So the person will seek a drug or behaviour that makes them feel this pleasure. Unfortunately, over time, more and more of the substance or behaviour is required for the person to feel the same feelings of pleasure. People can develop a tolerance for a substance or behaviour, so they need more and more to have the same feelings. Eventually, the person can develop a compulsion for the substance or behaviour, intensely craving it. Cravings can mean that the person finds it hard to abstain from the substance or behaviour, even after they're clean of the drug or substance for some time.